G'day guys, welcome to this quick little short webinar. I've got Mel with us today. Mel's one of our pods that works out of our Pakenham and our Narre Warren clinics. Mel, tell us a bit about yourself. What are some of your, what things do you like to focus on when it comes to podiatry and some of the special interests you have?
All right, so hi everyone, I'm Mel. So I work, like Dom said, across Pakenham and Narre Warren. So with podiatry, obviously there's a lot of different aspects of podiatry, but my main interest with my background is basically in our rehab injuries and strengthening. So I played a lot of sport when I was younger. I also am really into the gym, so that's kind of where my passion lies there.
Awesome. Many people don't really know that, what we do as podiatrists in general. And I think even less know that that we're actually pretty skilled when it comes to injury management and rehabilitation. So tell us, like, when it comes to podiatry and sporting injuries, like, what kind of injuries do we help manage, or can we help manage as podiatrists?
So basically anything foot and ankle. So that includes fractures, so of the ankle, any bones in the feet, which are quite common, especially in people playing sport, but also people beginning any type of activity. Also, so the common ones for those are your Achilles tendinopathies, fractures and ankle injuries. So ankle sprains and that, which are very common in a netball and things like that. So basically anything foot and ankle.
Yeah, and I guess another big one that, to a degree, if people do know that we manage some of these things, the one thing that most people tend to know we manage is things like arch pain or heel pain. That's probably one of our biggest, the biggest things that we see and help manage. But when it comes to sport, yeah, probably Achilles, shin pain, running type injuries, all of those sorts of things.
And even we can help with, so people that have just been immobilized or in hospital for a long time and they have a bit of weakness of the lower limb, so following maybe a hip or a knee surgery, or any type of, when you have a fracture and you've been in a boot for a while, we can help with the balance and the strength in that when you come back to your rehab, basically.
Absolutely, and we work pretty holistically and in terms of management, and we'll always bring in, physiotherapists and osteos and work with each of those patients on an individual basis, depending on what their needs are. Tell us a little bit more about the strategy specifically that we use as podiatrists when it comes to managing sports injuries or foot problems. Everyone knows that, yes, we do orthotics and things and footwear advice, but that's not the be all and end all. What else do we use?
Yeah, well, that's what I was going to say. So podiatrists, yes, we can help with footwear orthotics, but we offer a lot more of that. So we'll do our assessment. We use targeted stretching and strengthening programs. So that can include exercises prescribed specifically for you, some balance programs, and also, if we don't have the answers straight away, we work with other health professionals. We have good contacts. We can refer for imaging or get the opinions of people that we work alongside as well. So lots we can do.
Yeah, excellent. And I suppose when it comes to some of those things that you've described, like, flexibility and strength in particular, why is flexibility important? Like, what is it about improving flexibility that helps us manage some of those injuries?
Right. So a lot of our patients will say they feel tight or they can't move a lot. So when we don't have a lot of flexibility or our muscles are tight, we can't get the required range of movement or motion in some of our joints, so our knees, our hips, our ankles, and that just means that our body kind of compensates, and then we can overload other areas of the foot. So improving flexibility can improve our range of motion and then offload the injured areas.
Yeah, excellent. And I guess likewise strength, why is that important? I suppose when areas weaken, I'm assuming one of the things is that, that things can't function the way they need, but why is it so important?
Exactly. So strength is important when we're young, but also when we're old. So obviously we need the strength in our muscles to do our desired activities. So whether that be just walking or getting up off a chair, we need our muscles to be able to absorb those loads and get us moving forward, especially in the elderly as well. As we get older, if we were to have a fall or something like that, we want to have the strength to get us back up or stabilize us as well.
Yeah, and that's a really good point, actually. Like, a lot of people think that, strength and conditioning is one of those things that that young people do. Young people go to the gym, but the reality is that strength is really important in all facets of life, even if it is just getting out of the chair or walking the dog. And as we get
Yeah,
older, it gets harder to maintain that strength. If we don't keep moving, it does make it a bit more difficult. So tell us a little bit more then when it comes to strength. What causes that reduced strength or conditioning of muscles?
So, put simply, just use it or lose it. So, we see a huge reduction in muscle strength as we are young, active, playing all our sports, and then we start studying. We get our desk job that we're sitting at all the time. So basically, when we're not using it, we lose it. A common misconception is that as we get older, we naturally, because of our age, we lose strength, but that's not right, because we still see the 70-year-old triathletes who are running and doing all that. So it's just that they've continued to move. So an inactive or sedentary lifestyle, which is common these days, sitting down a lot, can cause that. However, also overuse can in some cases cause a bit of weakness in there.
Yeah, excellent. So what can we do to help improve strength? Obviously, moving helps, but are there specific things that you can recommend?
Yeah, definitely. So the best thing about muscles is that they're plastic and they can change all the time. So we can get our strength back. So a lot of the time we do different types of exercise programs. Sometimes they'll be targeted to the muscle, or we'll focus on a whole body part as well, and then we progress them as you get stronger to make them harder, and then that over time increases the ability of your muscles.
Yeah, I guess like everything, our bodies get used to certain things, so we need to keep challenging it and making it harder.
Yeah.
What's the difference? You touched on, I guess, isolated exercises and sort of holistic or global strengthening. What's the difference between the two? Can you give us an example? What are we talking about there?
So an isolated exercise or targeted will focus on one specific muscle. So that might be your calf muscle in particular. Whereas with the global or holistic strengthening, that's what we at Walk On Podiatry like to think of the lower limb as kind of a chain, or everything's interconnected. So it's not just one muscle that's responsible most of the time for a movement. So walking, running, sitting, it's usually a group of muscles of the lower limb that work together. So that involves targeting a few muscles through a number of different exercises, and these can include a squat or a lunge, whereas a targeted exercise might be just a calf raise or a simple TheraBand exercise with one muscle.
Yeah, awesome. And I think a lot of people probably listening to this might be a bit concerned or a bit worried that, I don't have a lot of equipment. I don't really know what to do. Like, what kind of equipment do you think people realistically need to help advance and move forward when it comes to strengthening some of those muscle groups that we're talking about?
Yeah, so basically with our plans, we'll get your history. We'll find out what resources are available to you. Obviously, at the minute, gym isn't available, but a lot of the exercise we start pretty easy, so that can be as simple as body weight. We then can add weight in. Some people have dumbbells, some people have access to a gym, but if you're at home and you've got some cans of soup or a bag of flour, then that's something at least. We also use common things like glute bands, or you might know them as booty bands, or TheraBands, and spiky balls or foam rollers, which can be easily picked up at our clinics, but also online as well.
Yeah, awesome. So really, you don't need a lot. Like a lot of, especially when the kind of people we're talking about, might be recovering from an injury or recovering from a surgery. So level of strength is going to be quite limited.
Yeah.
So often we're starting at the very bottom, and so really, body weight is probably the big one. And then, as you say, there's always household items around that we can use. To try and add a little bit more load if we need. That's fantastic. Thanks very much for the insight on strength and conditioning, Mel, and glad to hear that you've been able to share your passion with everyone else. Obviously, strength and conditioning is one of those things that we do at Walk On Podiatry quite a bit. The ways that you can get in contact with us are obviously through all our socials or our website. You're welcome to Google us, find us online, and reach out to one of our clinics if you do have a problem, or if you feel that strength and conditioning could be something that you would benefit from. Mel, thanks again for joining us. Everyone have a great day, and we'll speak to you all soon.